Hello everyone, my name is Dr. Shahriar. I hope so everyone is doing well, and today I'm just going to talk to you about few things, how to prepare for the AMC exam. I mean, that's one of the question I often got from the candidates. So I just thought, I'll give you a little idea, for the beginners, and let's just call it as a beginner's guide for the new doctors who are going to start the AMC. See, when you came from the MBBS background, there are little difference with this AMC exam and the certain other exams which you have finished at MBBS level, right? So the AMC is based on mostly on the clinical subjects, like means the medicine, surgery, gynae, obs, psychiatry. All right. Now a few things are a little bit more advanced. Like what are those things? The same thing which we learned like true-false system or MCQ system. Now we have to learn things in what is the initial test, what is the best test of, for example, pulmonary embolism is a popular topic. Not only if you go in AMC, if you go even in USMLE, PLAB, pulmonary embolism is a universally very important topic. So what to learn? You need to learn the clinical features. So they will ask some questions to make you a diagnosis. Some cases they will ask you what is the initial investigation. Right, so X-ray is something initial investigation like wedge shape opacity. Then the best investigation or maybe the next investigation. So next there are options like VQ scan or D-dimer. Now it depends on pregnancy cases. You will choose some other thing. In renal impairment cases, choose some other thing. Now you need to figure out this kind of thing. Thirdly, you need to learn what is the confirmatory. So CTPA. That's confirmatory. So this is a way of learning. The investigation, initial, next best. Then the thing that is coming, what is the initial treatment? What is the best treatment? Even if it's something related to hospital administration, like some of the condition, those are emergency. You also need to understand is there any kind of questionnaire system. You can follow that one, like CARB 65 for pneumonia. For asthma, there are some questions, TME for the MI. So certain different criteria out there, like child PAG score for some of the liver related condition, Ranson's criteria for pancreatitis. So now at this level, you have to follow this criteria about the hospital administration. Also try to understand the condition. Is it a mild? Is it a moderate? Is that a severe condition? So these kind of questions are so important for cracking the AMC. Not only AMC, even if you go in PLAB or USMLE. So this is a beginner's guide. Even 4th year, 5th year, what I'm telling right now, you can follow these words. So you have to also figure out what's your syllabus. So as I said again, the medicine, surgery, gynae, and all the sub branches of medicine, respiratory, GIT, cardio, renal, rheumato, endo, neurology, all these things are included, including poisoning. Afterwards, the surgery comes, general surgery, systemic surgery, INT, ortho, all are included again. The gynae ops, everything related to gynae ops, and final psychiatry, everything. Now, the authentic psychiatry, you guys never studied. I personally think, whatever I have seen in students, they never have studied the psychiatry in that way. They mostly know about what is hallucination, what is delusion, but here things are very much related to differentials. Like, I'll give you a scenario, like, something if it's related to paranoid, what can be the conditions and what things are coming in your mind is mostly schizophrenia, but there are 4 conditions that can happen with paranoid feature, like example schizophrenia, delusion, right, paranoid personality disorder, idea of reference. Now AMC will want from you, like you are able to diagnose from the question that which one is idea of reference, which one is paranoid, which one is delusion, which one is that is schizophrenia. All right, so different criteria, DSM criteria, Kaplan book, different psychiatry book. You take help from this thing, and also the management. What is the specific management of different condition? In which cases we need to increase the drug? In which cases we need to hold the drug? Some of the drug interaction, which is also very important in terms of the psychiatry. Apart from that one, some of the pharmacology from the basic subject also tested, especially the drug interaction and some of the drug related thing. Like say Alzheimer's, like I'm talking about clinical pharmacology. Alzheimer's has drugs like donepezil, rivastigmine, galantamine, mimantamine. So donepezil, rivastigmine, galantamine, these are the drugs for the mild to moderate. For severe cases, it's mymantamine. So they will give you a scenario. I mean, for example, they will ask you a patient who couldn't recognize the face nowadays, and there is progressive dementia. Please follow the word progressive dementia. Progressive dementia goes more with the Alzheimer's, and it is also mentioned in the question as per the stages, they cannot recognize the face, and that fits into the severe criteria of the Alzheimer's. Now, I told earlier, severe case of Alzheimer's treatment is mymantamine. So this mymantamine and the severe now fits. So they will ask in the question, which one of the following is the treatment for this condition? But they will give you the scenario of severe. They won't mention that mymantamine and things like that. So these are the certain things you need to remember and understand. Different exam has different applications. Some things, okay, MRCP, MC, same. No, it's not same. MRCP is mainly medicine based exam. Maybe a little bit more advanced medicine in certain cases. AMC is based on, again, I'm telling clinical subjects like, medicine, surgery, gynae, psychiatry, ethics, all these things are mostly included. The pediatrics, of course. So you need to figure out, you need to figure out the syllabus most importantly. So you can also study alone. You can also take help. Some of the courses, that's also okay. But make sure it's expensive exam. You really need a very tight preparation before going to exam. And another almost like if you go with some courses, it might take 6-7 months. If you are not taking courses, it might take a year. So please make sure while you are going with the MC, take a very good preparation. That's most important. Okay, and also you need to solve a lot of recall for MC. Not as much recall you never have to do in any other exam. So highest number of recall you have to solve for. There are MRCP recall, there are PLAB recall, there is certain things related to USMLE, but the highest number, believe me, I've gone through many of the exams, so it's mainly in MC, highest number of recall you have to solve. Recall means past paper, so last 2 year or 3 year you have to solve it. Okay, and solve it in correct way. It's not like you got a solve file, okay, this one answer, someone put it, that person can be wrong, by the way, and many cases they are wrong. They made this file because their concept was good, so it's better you don't follow them. Rather, you take that question and you figure out the references from different websites. Some of the groups are very helpful. shahriaramcguideline Guideline is a free group, the largest group currently, and also the Nzrex is another very useful group to discuss the AMC related discussion. Some of the question banks are also very useful, like there is Nzrex question banks, there is MCQ bank, nowadays there is another one, MPlux, also there is MC bestseller, that's also been of question bank related. So this particular thing, either of the one better to follow. It's not like too many things. Better you focus more on the recall and one question bank. That's my suggestion. Okay, which one you choose is up to you. Okay, and make sure you take a solid preparation. And one more tip, those have kids, in the last 1 month, if you have caregiver, if you have your parents with you, that's okay. If not, you can call your parents in abroad. They can come and take care of the kid in last 1.5 months, or ask your husband to take some more vacation. Make sure in the last month you study really well, not only for the mom with the kids, for everyone in the last month. Make sure you study really well. Okay, so these are a few vital important. Also, please check in my YouTube that there are more videos like MC frequently asked questions, what are the books to read for MC, okay, how to take the preparation for the MC, is your medical is eligible for MC. This is another very initial thing you should do. Most cases the medical colleges are recognized, but some cases if it's a new medical, maybe it's not. So you need to go to www.amc.org.au and you can check your med school, and I also have a video in my YouTube channel regarding that. You can also check that one. Okay, so best wishes from my side, and take a solid preparation for MC. If you need anything, feel free to ask in our comment section in YouTube. My best wishes to all the doctors. Those are going to take the preparation in AMC in 2020, 21, 22. Have a good day. This is Dr. Shahriar. Have a good life.